afternoon, everyone. It's Ollie and Brody from Be Mobile, and we are pumped to get into another session of the Be Mobile show this Wednesday afternoon. Today, we are diving into a very common condition or pain, you might call it, which is neck pain.
Second most common musculoskeletal complaint.
Is that right?
Ollie, yeah. Back pain number one, neck pain number two.
Yep.
I think shoulder pain number three.
Do you know the lifetime incidence of neck pain off the top of your head?
I don't know off the top of my head.
Okay. Well, we know back pain is around that 80 to 90%.
Shoulder pain is around 70%. I know that because we're having an in-service about shoulder pain tonight.
Right. So somewhere between 70 and 90.
So I reckon neck pain's between 70 and 90%.
So very high. So chances are you've had neck pain or
yeah.
You will have neck pain at some point in your life. So we highly recommend you continue watching. And who knows, you might learn something or a couple of things.
And shout out to Carmel, because this one of our listeners, this is a topic Carmel asked us to discuss.
Yeah, we always love hearing from our community because we want to provide the content that you want to hear more about. So that's really helpful if you give us a recommendation for something to talk about, discuss.
Right. So we'll have our little, not that little, but our discussion about neck pain, talking about sort of what it is and what you can do about it. And then we'll have a bit of a Q&A section at the end. So if you've got any questions about neck pain or about other stuff related to health and fitness and exercise, particularly for over 55s, we will answer that at the end.
Wonderful. And of course, we always love hearing from you in the comments. So if you have a question or an experience of yours or even a joke, that'd be preferable. Put it down and let us know, because you'll notice that we haven't actually got a joke today because we've scraped the barrel. We have no jokes left. We are desperate. So please send in a funny joke.
On that somber note.
Yeah. Let's get into it.
We could have a fun fact of the day, Ollie.
Oh, okay.
This is one I asked you yesterday, and I'm Googling it because I can't remember the answer. What is the furthest point from the center of the Earth?
Yes. That's a trivia.
Now, most people might think it is Mount Everest, but that's not the case. Mount Everest is the tallest, highest peak above sea level. But it is not the furthest point of land from the center of the Earth, because, Ollie, the Earth is, of course, spinning.
It is.
Due to that centrifugal force, I forget which one, the Earth is a little bit wider around the equator because of that spinning. So the furthest point from the center of the Earth is going to be a very tall mountain that is very near to the equator.
Yes.
And see if anyone knows in the comments. That's all the clues I'll give. So if you can think of a very tall mountain very near to the Earth's equator, that might give you a hint at what the furthest point from the center of the Earth is on land.
Yeah.
I'll reveal the answer a little bit later if we remember.
Oh, okay.
Or should I give it to them now?
No, let's hold on to it. Keep people watching. All right. Let's dive into neck pain. So we've already talked about how neck pain is a very common condition, but there are various classifications of neck pain.
Yeah, and by far the most common is what we call non-specific neck pain, like we do with non-specific low back pain, which sounds like we're not giving a real answer, but what that really is just reflecting what the vast majority of neck pain is, which is that we can't clearly identify one specific thing to blame, one specific cause. So it's just kind of general neck pain, everyday neck pain, by far the most common, as it is with low back pain.
And when you say cause, we're talking about one specific structure that is that we can explain the symptoms.
Yeah, so something that's not non-specific neck pain would be a fractured vertebrae in your neck. We can do an x-ray, we can see the fracture, we can clearly say that that fracture is the reason for the current episode of pain. But for 95% plus of neck pain and back pain, we can't do that. We can't say it's this one thing, it's this one muscle or one tendon or one ligament, because often it's not that clear, it's just kind of general.
Yeah, so those more specific neck pain conditions vary in seriousness, but oftentimes they require more urgent medical care. So potentially. So you talked about fracture. That's obviously one that you need to seek emergency care for. Of course, things like tumors or infections are other things. These are all what we would call red flag symptoms. Or red flag conditions.
And so red flags for us health professionals is something that indicates that something might warrant further investigation, further medical intervention, just sort of a more cause for concern. So we've got a little list of them here just to run through, that if you have neck pain associated with any of these, this is something that may indicate something more significant than just general neck pain, and so worth getting checked out. So obviously, if you have neck pain related to an accident, a big fall, car accident, or injury, obviously you need to get that checked out. So that's one. Another one, which may sound a bit funny, but problems with your bowel or bladder, particularly loss of bowel or bladder control, can be related to spinal cord issues. Obviously, if you have neck pain and sudden, bladder incontinence related to it, that's obviously something to get checked out.
Yep. If you're experiencing headaches with nausea, vomiting, dizziness, sensitivity to light, of course, many of you will recognize that's also the symptoms often of a migraine.
Yeah.
So not always a real problematic thing, but if that's a new thing for you, then definitely worth getting that checked out. And of course, if you've just got constant pain, doesn't change, stays the same all the time, it's throughout the night, throughout the day, no matter what
whether you're moving, resting, sitting, like whatever, if there's just true constant pain, that's something to get checked out.
Yeah.
Any systemic symptoms of being unwell, things like unexplained weight loss, fever, chills. Obviously, this is all pretty common sense for most people. If you've got that going on, you're probably getting that checked out anyway. And last thing is something that would indicate nerve problems. So paralysis, numbness in the hands, difficulty moving your hands, fingers in particular, associated with neck pain. Again, get it checked out. So those are sort of red flag conditions, red flag symptoms that you would want to get investigated. Other than that, for most neck pain, you don't need an x-ray or a scan or anything like that. And it's mostly something you manage yourself, which is what we're going to talk about shortly.
And the good news is, in most cases, it's going to get better in a matter of weeks, regardless of what you do. But there are some strategies that you can employ to
help it along.
Yeah, help it along. Make yourself feel a little bit better, which we're going to get to in a moment.
So let's talk about causes quickly. As we said, in non-specific neck pain, we can't really identify a cause. We'll get this image up on screen, which is a really nice what sort of graph is this? Kind of a Venn diagram. It's a graph just demonstrating the complexity that goes into a person's pain experience. So when someone has pain, these are all factors that are part of it, which means it's very, very hard for us health professionals or for anyone else to narrow down on one specific thing, because pain is influenced by all these things. With neck pain, there might be something that's led to it or triggered it. It might be some physical strain related to some new hot activity you're doing. Maybe you spent the weekend painting the fence or gardening when your body's not used to that. Maybe some new physical strain associated with it. Or it can be something less physical. It can be emotional stress, being sick, lack of sleep, all these sorts of things. But you can see in this graph, there's a lot that goes into it. Things that can be modified and things that can't. But just shows you how much pain is related to all these sorts of things: your cognitions, emotions, physical capacity, all sorts of things associated with things. There's a lot that goes into it.
And oftentimes it's not just one or the other, physical thing or a non-physical thing. We talk about that pain in the cup, and how the more you fill your cup to the point that it overflows is kind of sometimes how that pain works. So if you might be, you could be sick, you could then have a poor night's sleep, you might have stress related to work, and all these things are filling up your cup. And then one day you, as Brody said, you go out and paint the fence, or you go to the gym and do a new exercise, and then that is what triggers it. But really it's a combination of factors that can cause the pain.
And if you had less of those other things in the cup, then that physical stress might not have caused you any pain. So we sort of say pain is pretty messy and complicated. There's often different things at play. And it's just worth sort of acknowledging that and being aware of that, and not thinking just because my neck hurts right now, there must be something fundamentally physically wrong with it, because usually that's not the case.
Okay, so let's talk about what you can do if you find yourself with non-specific neck pain.
Yeah.
So I think, Brody, the first thing most people think when they get a sore neck is, I've got to rest it. Okay. And a lot of the times this actually might be true. It's what I would do. Okay. Certainly for that initial period where the symptoms are just so, sometimes so severe that you really just can't manage a lot of tasks.
Yeah.
But beyond that, if the pain is manageable, we'd actually encourage you to continue being active and encourage you to move your neck, because it is safe for you to do so, and a lot of the time it's going to be beneficial for you.
Yeah, and beneficial speeds. It's generally recommended that it's a good idea. With back pain and with neck pain, the guidelines say stay active. Advice to stay active is sort of the number one thing that everyone should be told. It's don't absolutely rest it. It's good to get out there, get active, keep doing all you can do, even if you have to modify things a little bit.
So there is a range of different things you can do, and we're going to categorize them by things worth trying and things that we think you're better off spending time doing something else. So
we'll bring up this image. These first four, not really an image, but it's an image of the first little list here. These are the first four things that are generally we think like recommended / worth trying. Now, in the field of neck pain, there's actually not a ton of really good research into specific interventions. So with anything in our sort of positive list or in our negative list, it's actually pretty limited research to guide us. But this is sort of a general overview and weighing up the pros and cons of each. So number one we got here is heat packs, putting a heat pack, a hot water bottle or something. The reason it's here is because it is so cheap, easy, safe, accessible. And so if it helps a bit with your pain, then great. It's such a simple, sort of easy thing to do. And if it can help with your pain a little bit, which there's some research and things indicating it probably helps with pain a bit, so worth it because it's simple and easy to do.
Yep. And safe, making sure that it's not too hot on the skin, and you don't fall asleep with something really hot on your
nothing's truly perfectly safe.
Yeah,
course,
yeah.
But it's quite safe.
But yeah, heat pack oftentimes can give you some good relief. It makes you feel nice anyway. So that's something worth trying. The second thing on that list is over-the-counter pain medication.
Yeah, so just paracetamol, ibuprofen, aspirin, things like that. Yeah.
Of course, once again, always worth checking with your doctor or pharmacist.
Yeah, it's safe for most people, but you do have to just check if you've got various intolerances to things or other medications that would interact. But generally pretty cheap, easy to access, and really quite safe and can probably help a bit. The evidence is pretty limited, but I think, if I had a really sore neck, I'd be taking some Nurofen or some Panadol or something for sure.
Yeah. Certainly, especially during those first couple of days where it can be quite bad.
The third thing we've got here is sort of an umbrella category calling pain management therapy. This is particularly for people with chronic pain, and this is sort of saying seeking further help with pain specialist medical experts if you're in that situation with chronic pain that's really affecting your life, and this can be worth doing. So there's things like pain clinics. It might be a pain specialist doctor. You might do some forms of like psychotherapy, cognitive behavioral therapy. So we sort of lump that all together as an umbrella type thing for people with more chronic pain, with pain that's become very debilitating and limiting their life. That is an avenue you can go down. There are pain specialists, doctors and experts that can give you more help if it's really impacting your life.
Yes. And lastly on that list is exercise.
Yeah.
Now, there is some evidence showing that exercise can be useful, like breathing exercises for your neck and your shoulders, and that can help with reducing the pain and, of course, increasing the range of motion as well. Now, what the evidence isn't clear on is what sort of exercise is best. But we're going to give you some suggestions in just a moment's time.
Okay, so those are the things that are generally worth doing. Now I've got a list of 5 things that are probably not really worth your time or not the best things to pursue, and we'll talk about for each of them why that is. Largely for all of them, it's just due to a lack of evidence of them being effective for neck pain. So the first one is manual therapy techniques. So we're talking about massage, manipulation, mobilization type treatments, whether done by a physio like us or by a chiropractor, osteopath, manual therapist, massage therapist, etc. The reason we say these are less likely to be worth doing is because the research really hasn't shown them to be reliably effective. There's some research indicating these things can help with short-term pain, and some people will anecdotally report that it helps to them, but there actually isn't good evidence to say it really makes a big difference. And because they aren't that necessarily cheap, accessible, or easy, it's probably not worth it when there are cheap, accessible, easy things like heat packs and basic exercises that are going to get you probably just as good a result. For us physios, we have clinical practice guidelines that sort of guidelines for how we do clinical practice, obviously. And they generally, regarding neck pain and back pain, say things like manual therapy can be included as part of a comprehensive management plan, which should also include exercises and patient education. So as physios, we're sort of told you can do manual therapy, but really you don't have to.
Mm-hmm. Yeah, and I think a lot of people out there will recognize that hands-on things like massage or going to a chiropractor can be really powerful, can reduce your symptoms.
For sure.
But for those reasons, it's probably not worth being the number one thing or investing a lot of time and money into it, because it's just not that reliable.
Yeah, if you find it works for you, go for it, that's fine. But the main thing is to understand that it's not needed. It's not fixing or correcting anything. It's just a pain management tool that will work for some people and not for others. So don't feel like you have to get massage or you have to get that chiropractic adjustment. It can help, but it's not absolutely needed.
Yes.
The next thing on the list, Ollie,
we've got TENS, we've got ultrasound, we've got laser.
We've lumped them all together.
We've lumped them all together as these sort of technological ways of rubbing a sore spot.
Yeah, and we've lumped them all together because none of them have been shown to do anything with any reliable research. So really not worth your time or energy. It'd be great if we had a little tool we could put on you that would really reduce your pain, a little laser light, fix your pain. It doesn't work like that.
If there was one that worked, there wouldn't be a whole list of them. There would just be one.
Yeah, exactly. Next, we've got acupuncture or dry needling. same thing, just no good quality study showing it to be reliable. So clinical guidelines don't recommend doing it. Yeah, not much more to say about that. It just hasn't been shown to really be effective.
Yeah. The other one listed here is neck braces. Of course, a really useful tool if you have a fracture.
Yeah, which is
beyond that, we wouldn't go recommending those. They're keeping your neck in one spot, which can provide symptomatic relief.
Yeah.
But as we discussed, it's actually a good idea not to be resting your neck and actually getting it moving and carrying on all your daily activities and physical activities.
And those neck braces were quite common in the past, but now a lot of the guidelines specifically say do not give people neck braces.
There you go.
Like Ollie said, other than if you've had like a specific fracture and a specific orthopedic specialist is giving for it, that's when it is needed. But for most people, it's not. Lastly on this, so.
Oh, we got a.
Okay.
Sorry, everyone. We just got a little mic problem here with Brody that we're going to adjust. So the last point on that list is ergonomics or postural adjustment. So once again, there's no good quality studies showing that ergonomic changes in the workplace can improve neck symptoms.
Yeah.
So not something to be too worried about.
And we used to have more rigid guidelines about the sort of correct or ideal sitting posture, but now we're sort of doing away with those because the evidence really hasn't supported those actually being true. We've talked about posture before, and that there's no really correct posture. Sit in a way that feels comfortable. Moving and changing positions as often as you can is probably a good idea. But yeah, there's no perfect posture. You don't have to sit up perfectly straight, and that's what's going to fix your neck pain. That's just not how it works.
Mm-hmm. Okay, and you may notice that we have left out a couple of things off that list, which are the more invasive sort of treatment strategies. Yeah. The first one being injections, like corticosteroid injections, for example.
And these really haven't been well researched, so it's pretty hard to find whether or not they're effective. Yeah, at this stage, there's not research showing that they work, but it hasn't really been studied very much at all. So.
And with regards to surgery, it's really a last resort option. Okay, so if you've got a specific, identifiable cause that can be theoretically improved with a surgery, then it might be worthwhile. But we know with things like disc changes, they can actually resolve on their own without having to go under the knife. Yeah. So keeping those as a last resort option.
Okay, so that's it for things that are probably worth doing and things that are probably not as much worth doing for your neck pain. We mentioned exercises as something worth doing. So for our last little section here, we just thought we would talk about a few different types of exercises you can do, starting with sort of the most basic, the least challenging, and then progressing from there little by little.
Yeah, so I think you can try some of these and see what's best for you. So the first thing that most people are familiar with is some stretches or moving.
Classic neck stretches, these sorts of ones.
Yep. You can do rotational, you can go up and down, these sorts of things. And we're actually going to talk next about what we call active range of motion. So very similar, but instead of holding a stretch position, you can take your neck through those ranges of motion.
So there's nothing all that special about stretches. It's just a type of movement, a type of load on the joints and muscles. And it can be a nice starting point for someone when the neck's feeling really stiff and sore. But you definitely don't have to stretch a stiff neck. It's just an option to start with. Yeah,
and it can certainly feel helpful sometimes. Next up is strengthening exercises, in particular isometric strength exercise. So isometric exercises are ones where your muscles are contracting, but nothing's moving. So we've got a great YouTube... I can say this because we've got a YouTube video where we go through different isometric neck exercises. So you might use your hand as resistance and push against your head and try to hold that position. And you can do that from all different angles. And you might start with 10-second holds, making sure it's nice and challenging, but of course, what you can tolerate.
Yeah, so as you're pushing against your hand, it's just making the neck muscles work a little bit, but it's a fairly sort of controlled way of moving them because you're not really moving that much. You're just kind of tensing the muscles against that pressure, which can be a good starting point for a quite sore neck before you move on to more advanced strength exercises.
Yeah, definitely. And then, of course, you can go on to more dynamic neck strength exercises. So you might be loading your neck in different ways. So, for example, you could be doing things like, can you just confirm I can be seen here? Producer Alicia? Yeah. So you might be doing things like this, starting with just lifting the weight of your head But ultimately, you could even add bands. So having a band underneath your hands and around your neck and using that band as resistance, or even somehow attaching a weight to your head.
You can do that.
Possibly. Things like lying on the back as well, Brody, and lifting the head up off the floor.
Yeah, little like neck crunches or neck curls to work the muscle in the front of your neck.
Yep.
And obviously, both of these options are a bit more advanced. So this is something you do only once the neck is feeling able to sort of comfortably handle that. The reason we do those kind of lying on the ground or in that leaning forward position is because it's going to work the muscles a bit harder against gravity. When you're upright here, the muscles don't have to work that hard to move your neck up and down, but leaning over on hands and knees, you're now working harder against gravity with rotations and things. So those are just some ways to sort of work your neck. We're not being hyper specific about these because it doesn't really matter. As we said, there's no evidence about which kind of thing works best. It's just about doing exercises, doing some movement and seeing what helps. So just do a minute or 2 minutes of each one, do 3 sets of 10. It doesn't really matter. Do some rotations up and down. The thing is just moving the neck regularly, doing that a couple of times a day sort of thing could really help.
And I think one of the best things about exercise in the case of neck pain, Brody, is just building the confidence that your neck is safe to move.
Yeah.
It can be really reassuring if you just do some gentle exercise and see, well, my neck pain hasn't actually gotten worse.
Maybe even feels a bit better.
And over time you can progress and load it a little bit more. And as you do that, your confidence will improve. And lastly, general strength training.
Yeah.
Okay. So, like all we do in our workouts, deadlifts, squats, rows,
especially stuff that works the shoulders, overhead presses,
yep.
front raises and things help because, you're doing shrugs, lateral raises, front raises. It's working these muscles in around the upper shoulder and neck area, which can really help.
Yeah,
well.
And exercise in general is typically helpful for conditions of all sorts, not just specific neck exercises.
Even going for a walk, for example, can help with your neck pain. So if the neck pain's so sore, you don't even want to move it, but you can tolerate going out for a 10, 15-minute walk, like that will help. Just helps your body in lots of ways. So yeah, any general exercise you can tolerate is definitely worth it.
Great. Okay, Brady, I'm sure everyone wants to know the point.
Yeah, we'll get to that little trivia. Alicia, do we have any answers to my... did anyone get it? What point on Earth is the furthest from the center of the Earth? I gave a big hint that it's going to be a tall mountain near the equator because it's not Everest.
Is it Mount Kilimanjaro?
No, it's not Kilimanjaro.
Oh, not Kilimanjaro. Close. Is that close?
Ooh, I don't know. Got it. Well done.
Well done, John.
Yes, it is Mount Chimborazo in Ecuador. If you got that without Googling it, very well done.
Very impressive.
So the summit is 2,000 meters further from the Earth than further from the center of the Earth than Mount Everest, despite it being a much shorter mountain.
Wow.
Because it is right next to very close to the equator. So because the Earth's
go.
bulge, it's further from the center than Everest. There you go.
There you go.
Fun fact for the day with trivia.
All right. Well, let's keep it moving. We have a great question from Karen. And I'm going to go ahead and read it. Right?
You read it.
And then we can answer it together.
Yeah.
So Karen says, there seems to be a lot of health charities doing exercise-related challenges. The British Heart Foundation just did one, which seems quite sensible. And now Stand Up to Cancer UK are advertising a 100 squats per day challenge. Seems to me that this goes against advice to have rest days in between strength training. And I was wondering what your advice was. My other question is, what actually is a rest day? Is it just a day when you're not doing cardio, strength, or balance? And does brisk walking count? Currently trying to do strength training every other day, cardio session on one of my non-strength days, and a balance session on the other, with the goal of 30 minutes minimum of brisk walking every day. Okay, so let's tackle this first part, Brody.
Some interesting thoughts raised by Karen there. Yeah. So firstly, doing something like 100 squats per day is a great idea for a challenge just to get people moving. It's just general physical activity. Although we use squats as a strength training exercise, just doing squats like that doesn't necessarily mean it counts as sort of strength training. So if you were to do 100 squats throughout the day, maybe you're doing 5 or 10 every hour or so, they're just body weight squats, you're just kind of fitting them in until you get to 100. That's not really the same as doing strength training. That's not really the same as doing 3 sets of squats back to back, a minute or two apart with weights. So it's not as much stimulus, it's not going to be as much fatigue and stress on the muscles as doing squats in an actual strength workout. So we'd say that doesn't really count as strength training.
Yeah, and as far as the advice to, have a rest day in between strength sessions, it's a rule of thumb as opposed to a hard and fast guideline. So I was talking to one of our members, Kathy, yesterday about this in particular, and I was explaining to her that when we give that advice to have a rest day, we're trying to accommodate everyone, right from people who've done no strength training before. So if you hadn't done any strength training, you when you did 100 squats a day, your legs would be very sore, I have no doubt. In which case, you would need a rest day. But if you're someone who's very well trained, you're squatting heavy weights, you're doing it regularly, you can get away without a rest day in between. As well. I just thought I'd make that point.
And in terms of doing strength workouts to improve your strength and build muscle, the guidelines say you should do that at least twice a week. 3 times per week, you're certainly getting more benefit. It starts to get diminishing returns after that. 4 times is a little bit better than 3. 5 times is maybe a tiny bit better than 4, but you're really getting into diminishing returns at that point. If you're working kind of all the main muscle groups in a workout, in our online workouts, we do hit all the muscle groups, which is why we say have a day off between the workouts. So do them Monday, Wednesday, or Monday, Thursday, or if you're doing 3 a week, do Monday, Wednesday, Friday. There are certainly strength training and muscle building programs where people do it every day. Like a bodybuilder is obviously at the gym every day doing strength hypertrophy type training, but often they're going to hit different muscle groups in each workout so that the same muscles are having 2 days rest sort of thing. So they might do like chest and arm exercises on Monday and then leg exercises on Tuesday and then back to chest and arms on Wednesday sort of thing. That's a simplification, but that gives you the idea that those main muscle groups are getting a day or so to rest. But as I was saying, it's not really a hard and fast rule. It's just kind of a rule.
Yes, absolutely.
Now to Karen's sort of other point about like what actually is a rest day. We say on the days off between workouts, do some cardio, do some balance, do walking. So that wouldn't really be a rest day. It's just a day of not doing strength.
So it's a strength
free day.
It's a strength free day.
But you can have true rest days as well. You really do no intentional exercise. It's unclear whether these are needed or not. Like you can do exercise every day for the rest of your life, and you can have a rest day every week or every 2 weeks, and you'll probably be fine too.
So as far as these sorts of challenges, Karen, we think they're great. We actually had a challenge, I guess you would call it, run here with our studio members recently. We think they're great for drawing attention to these issues and of course getting donations and getting people to do a little bit more physical activity. We'd just be advising caution for people who haven't done much exercise diving into something like this.
And Karen said, last point, Karen said, does brisk walking count as a rest day? It just depends on your definition of rest day. For some people it wouldn't, for some people it would.
It just depends on your level of condition.
Exactly. If you're exercising like hard for 30 minutes to an hour, 6 days a week, and then on Monday you just do a brisk walk, like for you that might be considered a rest day, whereas for someone else that would be an intense workout. So it's all relative. But
good question.
Good
one to spur some thinking. Okay, great. Let's have a look in the comments here. This one from Libby. Oh, sorry, I've just hidden it there, Alicia. Hi all, can neck pain during and after exercise be exacerbated by head position? That is, looking up too much during exercise or even looking down, get a lot of neck pain. Certainly can, Libby. And that's just going to depend on you. So we would just recommend finding a head position that you find most comfortable. It's hard for us to say definitely keep your head down or keep your head back or keep your head straight. Just find what works for you. Anything to add to that?
No, not really. I would love to give you a more simple, clear answer, but really, it is just up to you finding what works for you. I will just apologise for my coughing. I've been a bit sick, and it's a bit of asthma that I'm still just recovering from. So
that's right. Forgive you, Brody. Any other questions that I've missed, Alicia? Here's one from Helen. Many people say your neck and shoulders are all knotted. What are they referring to? I'm going to let Brody rip into this one.
We could go down a rabbit hole here. I'll try and keep it brief. One of the most nonsense phrases people get told is when a physio or a massage therapist or someone touches your neck or shoulders and says, you're really tight here, or that's the tightest shoulder I've ever felt, or there's a big knot here. That's all nonsense. How do we sort of sum this up? People feel like they are tight. We've talked about this before in other videos. Feeling a sense of tightness doesn't mean things are literally tight. It is just a sensation. when a practitioner like us physios or a manual therapist, massage therapist person puts their hands on you, they are influenced by all their own biases about what's going on, all your biases. No research has shown that to be a reliable way of distinguishing pretty much anything about someone's body. Our bodies are really lumpy and bumpy and full of all sorts of weird things. No one can put a hand on you and actually say, well, that's tight or not, or sore or not. They've done studies where they blind these people to, what side of pain someone has, and they say, you've got to guess if they're pain right-sided or left-sided, and they do no better than guessing. And these are people who've been massaging people or physios that have been doing it for 20, 30 years, and it's no better than a coin flip whether they get it right. So I wouldn't take seriously anyone ever telling me, well, that's tight or that's knotted or not. It's just not reliable. It's a bit of pseudoscience, really.
Yeah, and having a muscle knot is just a metaphor, and what they're really talking about is
a sore spot,
which only you can identify. Right.
And we're not even sure what these sore spots really are.
Yeah, it's certainly not the muscle fibers all getting up into a tangle.
Trigger points is another word people use for that. Instead of a knot, they say it's a trigger point. But again, it's just like a made-up phrase that no one's actually, with good quality research, established what that even really is, whether they really exist or not. What we do know is people sometimes have sore spots in their muscles. That's about all we know about it. We can't find them reliably. We don't really know what they are or what they're not. It's just kind of it's all a bit unknown. But yeah, things get sore sometimes, and keeping positive and moving usually helps.
Yeah. And just to add on to that, oftentimes people are told they're really tired or they've got knots or whatever. You need to loosen that up. You need to get a massage ball in there. Don't do any strength work, because that's going to help tighten it up even further. Yeah. That is also nonsense.
Yes.
Strength training doesn't tighten up muscles. In fact, can actually improve your flexibility. So we'd be recommending, if you can tolerate it, keep doing all your strength exercises.
And also, massage and stretching doesn't loosen muscles either. It might feel like that. They might feel tight. You get a massage and they feel less tight. Great for you. But it's not physically changing the tissue. The tissue wasn't literally tight, and now it's been, smoothed out and massaged out. That doesn't happen either. So another reason why we say massage isn't that important. But if it helps you with your pain, sure, go for it.
Fantastic.
Okay, and sorry, a bit of a rabbit hole there.
Joan says, I read it a few days ago, referring to Mount
Chimborazo.
I lost it already. Straight out one here. And then I think, to summarize the show for today, E. Davidson says, learn something every day, including geography. You never know what you're going to get with the BMO show. So I'm glad you've learned something. Okay, well, I think we might wrap it up there, Brody. That's been some useful discussion. And hopefully, as we said at the start, you learned something new. And we hope to see you next week for the Be Mobile Show. See you later, everyone.